So I'm hoping this will be an easier audience than that, right? But I finished that, threw the projector in the car, dashed down I-40, and here I am. So I'm really excited to be here again. I was really blown away by the gala that I had the opportunity to do climate cure speech. So congratulations on $500,000. It's really amazing, very exciting. So my story, I'll try and give you the condensed version, and I'll try not to get all choked up. It's still 10 years later, kind of gets to me every now and then. But my story is very similar to probably a lot of you in this room, right? I'm at SAS. I have almost a 25-year career in high tech at SAS Institute there in Cary. Some of you may know Dr. Goodnight. He spent a lot of time down here in Wilmington as well. But I was in a conference room and got a call and it said, you know, you got to get to Big Wake Hospital right away. And I knew nothing, right? I knew nothing. And so anyhow, that's an emotional time, right? We go through tears and fears and anger and all this kind of stuff. But when we got through with that, a little bit later, it took a little bit of time, but not that much, we decided we wanted to make a difference. And JDRF reached out to us while we were still in the hospital. And the day we got out of the hospital, there was a JDRF volunteer that was in our kitchen with her son. And her name is Cindy Mesa. She actually lives down in Wilmington now. And she had a real simple message for Suzanne and I. And it was, you can do this. Chance can still follow all of his dreams. It's hard, but you guys can do it. And so ever since then, we have been all in on JDRF. About 6 weeks later, we did our first walk team. We raised $500, and we were really stoked about that. We were really proud of ourselves, had a good time, all this kind of stuff. I may not have mentioned Chance was 20 months old, so he wasn't.
Want me to put a picture on?
Oh yeah, put that up there.
Let me see.
It's somewhere up there, or maybe not. That's fine. I'm driving down the highway, and you're not supposed to do this. But I was texting photos of Chance, but Aaron was trying to squeeze it in. But anyway, we may throw it up later. But so yeah, so we went from doing our first walk team and raising $500 to 10 years later, through advocacy at SAS and support from some key executives, our walk teams have raised $30,000 and $35,000 the last couple of years. Suzanne and I have been involved with the gala. I started off doing photography for it. She was the co-chair last year and this year. For the first time in our Raleigh chapter, we did $1.1 million last year. We did $1.2 million this year. Really exciting. We mentor new families. We go to picnics in Durham. We go to Easter egg hunts. Chance was the Children's Congress representative 2 years ago, along with Maddie from your chapter, and they were best buds down there. Maddie's a couple of years older, and she babysat for Chance when I was giving the keynote down here in Wilmington. So it's just, and Suzanne and I, we did some charitable stuff here and there, but we've never really gone all in with the charity. And this is the club that nobody wants to belong to, and we don't want anybody in here, but it's an amazing club once you're in. And what I would tell people, and I tell people this all the time, is whatever you give into JDRF, it comes back tenfold. And we have been really humbled by that. So as difficult as this journey is, and as much as we've gotten involved with it, we connected JDRF with the Tobacco Trail Marathon up in Raleigh. And so they've been the primary donor to JDRF out of their funds because it's a nonprofit marathon. So that's raised $300,000 over the last 5 years. So everything we do, we just give back more and more, and we're really excited to be a part of this, right? So I'm very passionate about it. My point here is you don't have to do all that stuff. Just choose one thing. Choose one thing that aligns with your interests and get involved, and you'll be so happy. You can make a difference doing one thing, doing just a little bit here and there. Everybody's really busy. But choose one thing, align it with something that you're passionate about or an interest, and amazing things will happen, really amazing things. I'm going to buy this one right here. So JDRF drives research. So in full disclosure here, not a scientist, not an endocrinologist, don't play one on TV, even though I know there's a big TV industry down in Wilmington, right? I'm just a T1D dad who's passionate about this. I am a research information volunteer, so I sit in on a national monthly update call that has all the top scientists from JDRF on there once a month. really fascinating. If you're interested in that, it's another way you can get involved with the chapter here, and then you can help kind of do what I do, right? Evangelize this. But here's where I start, right? JDRF drives all of the research around the world. They're the largest raiser of funds, but then they're really good stewards of funds, right? Because one of the things I did was, before I got involved, I wanted to know that my money was going into good causes and being stewarded responsibly, correctly, really well, right? Because I've been in business, and so, I look at this from a business term, right? When I go out and do deals with SAS, all of our customers and their clients, they want to know what the return on that investment is, right? What's the ROI? And that's kind of, maybe it's the right way to look at this, maybe not. But I look at, hey, what's my ROI? For all the time that we put into JDRF, for all the money we raise, what's my ROI? And it's really amazing. JDRF is one of the better nonprofits at stewardship of the funds that they raise. Over 80 cents on the dollar raised goes directly into research funding. So that's kind of, to me, where it starts. In fact, at the Raleigh board, we had one of the International Board of Directors at our meeting, because he was in Singapore, he's just moved back to Raleigh, and he helps direct this. So that board that decides where all this money goes, it's scientists, it's doctors, and it's moms and dads of T1D, right? So it's really, really responsible way to do it. Just to touch real briefly on what JDRF has been able to accomplish, over $2 billion with a B has been raised since 3 moms got together in 1970 and started this organization. Over 150 grants, 21 countries across the globe, and I'm actually organizing a call with our international director next Monday or Tuesday. We're actually putting more emphasis on these international countries, because we don't have good data. And I'm going to talk more about data. I won't geek out too much, but I'll talk more about data a little bit tonight. But we don't have good data about how big is this problem globally. We got pretty good data about how big it is in the U.S. and in half a dozen or more different countries outside. But globally, we're flying in the dark. We don't know that. But this is the one that I want to touch on for a second. So Chance was diagnosed at 20 months. He's 11 years old now. Last week of 5th grade, last week of elementary school. I'm sure my wife's going to be in tears this weekend. But she don't want him to grow up at all, And there were 2 or 3, and I'm like, I can't wait for 5. But when we got involved, there were less than 10 human clinical trials. It's just 10 years ago. There were less than 10 human clinical trials. There wasn't anything to test. It was still in the research labs. It was still in the universities. They were ideas on paper. Today, there's over 75 human clinical trials. And each one of those may be a path to a cure. It may be a path to solve complications. It may be a high-tech path to improve lives. It may be a biotech path to improving lives, right? So to me, that's really exciting, right? And if you think about just this last year, and I may be getting out of order with my slides a little bit, but just this last year, there was over 11 FDA approvals. 11 FDA. This is a big federal government agency, right? Not that our federal government is not here to help us, right? They are, but to get 11 approvals in 1 year, it's never been done before. Because advocacy is a big part of what JDRF does as well, right? So it's been a really exciting year. So, all right, now this is where I'm going to go a little bit off script, but I want you guys to stay with me here. Full disclosure, and I want to make sure Aaron and everybody understands. This is the Heath Clayton way of looking at things. JDRF does not advocate what I'm about to say and how I'm going to gauge it, right? This is just a dad. This is how I look at it. Because, earlier Aaron mentioned that you guys are going to have your first research event at UNCW. I would encourage each and every one of you to go to that event. Here's why. We went to our first one. It was September 19th, so October, November, December, January. It was less than 5 months after Chance was diagnosed. Wow. We went to this research thing, and it was great in 3 different ways, right? So Chance had just turned 2, right? So all he did was run around and play with little kids that all had diabetes, right? And so he was kind of clueless, but he's 2. You'll give him a pass on that. Suzanne connected with the other T1D moms. And there's a key member in Raleigh, Mike Nerona, and if you guys haven't met him, if you ever get a chance to meet Mike. He's amazing. And he has this whole talk about T1D moms and how, like, they're different beings than human beings. They're just amazing people, right? And nobody else on this planet can compete with them, right? And so Suzanne connected with all these other T1D moms, and that was amazing. And me, I'm the over-analytical one, right? I'm like, you know, some of my friends would say really, you know, towards anal, right? But I overanalyze everything, and I want to know all the facts and all this. So I went around to all of these sessions, right, to just learn everything I can learn. That's your opportunity at this summit coming up, and I encourage you to do that. One in particular, I remember, I went there, and there was this guy kind of talking about this new high-tech gizmo, and they're going to combine a couple of things. And he said, hey, here's what we can do. We've already done this. We can keep someone's blood sugar perfectly flat, between 100 and 120, for 8-10 hours at a time, as long as they don't eat and they don't move. And that's what everybody in the audience did. They all laughed, and myself included. What the heck good is that? And he goes, no, wait. Think about it. We all get asleep. We all get asleep, right? For 8 years, Suzanne and I were on call, just like doctors, every other night. We didn't sleep through the night, really, for 8 years, right? So, at the end of that, I raised my hand. Like, hey, what's the time horizon on that? It's like, it'll be on the market in 5 years. I'm like, wow, that's good. Chance, you know, he's 7 years old. That's workable. I can hold out 5 years. We want to make this work. You know, and then the next year I go to another research update and I raise my hand, you know, after something really impressive was told to me. And I said, hey, what's the time horizon on that? He said, it'll be 5 years. And every time I got in front of scientists, doctors, researchers, at the end of it, I got the same answer, it'll be 5 years. Until I got in front of Boris. I can't pronounce his last name, it's Russian. But Boris works up with JDRF, but he is actually a doctor, mathematician doctor, at University of Virginia in Charlottesville. And he got up, he showed this great thing, kind of like a presentation like this after dinner, except he brought up a live webpage, and we were looking at people's blood sugars like over in France live while they were sleeping. It was later over there, right? And these other people, this one guy spiked, he's like, oh, he must have had dessert, you know? So I raised my hand, I'm like, hey, what's the time horizon? It'll be on the market 2 or 3 years. Wow. So here's the Heath Clayton view, right? Thought I forgot about that. I didn't. So I look at time horizons. There's the now to a 5-year horizon. And then there's the 5 to 10 years, and then there's 10 years long. Now, that's not JDRF's view. There's a lot of scientists that won't buy into that. That's a dad's view. And it's particularly relevant now because Chance is 11. If we get another breakthrough in 5 years, then I only have to worry about a boy teenage driver versus maybe somebody who has low blood sugars and high blood sugars, right? And if we get another breakthrough in 10 years, then Suzanne won't stay up every night worrying about her son away at college, right? So I look at this on the 5 and the 10 years. So what I'm going to talk about is, hey, here's the here and now and the next 5 years. And what I put in that category is those are the high-tech stuff, or as Chance likes to call it, is gadgets, right? He's got all these gadgets here. Matter of fact, he has the same pump, right? So he is on the Medtronic 670G, as is Maddie, and we're on it because Maddie's on it. When he went to Children's Congress 2 years ago, there were 5 North Carolina delegates. One was on it, one had it sitting at home that didn't have their training yet, and one had it on work. And Chance became the first child in the Wake Med endocrinologist practice that went on a pump. He also, on a closed loop, he also went on a pump when he was 2 years old. And about 2 years ago, he was listening to this conversation where we were telling people when he went on a pump. He goes, oh, what do you mean? Because I thought I was born with that. Huh. It's not a bad way to be, though, right? Because he doesn't miss not having it. But right now, it's really cool, right? Because for 8 years, Suzanne and I's brain were his pancreas, right? You have to count every carb that goes through your lips. You got to do some math, right? You got to figure stuff out. He's going high. Why is he going high? I got to get back down low. He's crashing. I got to get him back out right really quick, right? Now, he has an artificial pancreas. So, he has the Medtronic 670G, and that's a pump. But it talks to the CGM, continuous glucose monitor, right? This is amazing. Let me show you how amazing it is. This is Chance's pump. So I don't know if you can all see it, but that's a pretty flat graph. And it varies between 100 and 150. And that is how his chart looks almost every single year. Suzanne and I have slept more in 2 years than we did the 8 preceding years. Now, occasionally we still have alarms that go off, right? But it's occasionally. It's not every third night or every other night, right? The scratches he puts on during the day. He's a big rock climber. That was the picture I was trying to put in here. He and I went up to Linville Gorge because he climbs in these new fancy, rock climbing gyms with all the little handholds. And he's really good. He's kind of proud of that. He should be. He's talented. And but I said, I'm the gray-haired dad, right? I'm like, yeah, Chance, that's good, but it's time you get on some real rocks, right? So we bring him out. We went up to Linville Gorge together, just a Father-Son trip. So this is amazing. It's really amazing. This is all funded by JDRF to get started. The artificial pancreas, the first idea of this was JDRF scientists, JDRF funding. If you talk to Medtronic, any Medtronic rep, and I actually spoke at their Southeast sales meeting earlier this year, and I told them, I said, I hope you guys realize, right? You're not selling pumps. You're not selling CGMs. You're not selling artificial pancreas. By the way, they hate that term. It's a closed-loop system. I said, but what you're selling is you're selling sleepovers. Chance did his first sleepover after he got on the 670G. Before that, he only did sleepovers at really close friends because either mom or dad went to sleepover. Now that's a little embarrassing once you get 10 or 11, right? Either mom and dad or sleepover weekend. But he did his first sleepover, right? He self-managed starting in 4th grade. Starting in 4th grade, he self-managed all day at school. Teachers, nurses, principals, nobody helps him. He does it all, right? So that's what they're selling, and it's amazing technology, but it will get better. It will get better. But if you talk to any Medtronic rep, they'll tell you the investment by JDRF accelerated this closed-loop system to market 3 to 5 years. 3 to 5 years ahead of when they thought they could get it here. All right, so this is where I'm going to get a little bit geeky on you because, so SAS, for those of you who don't know, we are an analytical software company. All these little buzz terms you may hear floating around about big data and artificial intelligence and machine learning and all that kind of stuff, that's what we do, right? So here's a really interesting thing that most people are like, whatever. It's a big deal. JDRF, with the help of the Helmsley Foundation, is sponsoring Tide Pool. Tide Pool is a database. Any of you out here that have a CGM or a pump and are willing to donate your data, it can be anonymous, but you donate your data, they're bringing it into Tide Pool. So why is that important? Well, we work at SAS, right? We go out and we sell this analytical software to companies. And we go out there and we tell them how brilliant we are. Some of them don't believe us. They're like, we'll prove it, right? Here's a little project we want you guys to do. We're like, that's great. Do you have the data? Because without data, you can't do analytics. And in today's world, all those doctor forms that you have to fill out every single time you go back to the doctor? About your privacy and all that? Nobody's allowed to use your data. So Tide Pool says, hey, all of you have a valuable asset. It's your data. You can donate it to Tide Pool and upload it. And now they're working with other companies. We're actually having a conversation with SAS as well about doing some analytics on this data and finding out things. And here's the really cool thing about analytics is you don't know what you don't know. The classic example back in the 90s, late 90s, early 2000s was people started doing what they call data mining, right? You just take this bunch of data and you start looking for patterns, right? And they were doing this with grocery store data. And they came up with a correlation that every Saturday morning, diapers and beer spike. Now, who was thinking about that correlation, right? Well, it turns out you're right, not to be sexist here, right? But apparently some moms were tired of dealing with everything all week long, And the dads are there, and they're like, hey, get your butt out of bed, Dad, and go down there and get some diapers. And dads were like, oh, okay, I'll be a good father, good dad. And then they're like, well, I'm here. Might as well go get some beer. And so grocery stores use that. They used it in one of two ways. Either they're like, hey, we'll be really nice to our customers. We'll put them right there together. Make sure that Dad's not half asleep and forgets the beer, right? Or we're going to put him on opposite side of the store so he can find all this other stuff that Mom didn't want him to buy over there while he's going to get his beer. So, but there's things like that in data that nobody ever thinks of, right? But you can find it with algorithms. You can find it with this higher math. Tide pool, we have no idea where it could lead us, but it could lead to really interesting things. And it's important, and JDRF is sponsoring it. All right, this is what's also cool. So, this idea of open protocol, right? We love Medtronics. Love them. But I have to have a Medtronic CGM, I have to have a Medtronic pump, I have to use Medtronic algorithms, right, the math. I have to use Medtronic supplies, blah, 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 right? Well, wait a second, but, you know, when we want to go out and buy an iPhone or an Android phone, we get to choose. We can put it on Sprint, we can put it on AT&T, we get to choose, right? Why shouldn't all T1Ds have that same choice? So Aaron, and you know, Aaron Kowalski just took over as the CEO. And if you haven't had a chance to meet Aaron, I've had an opportunity to sit down with him 3 or 4 times, a couple of one-on-one. He's an amazing individual. This is his idea. He's pushing this hard, right? But here's where it goes. If everything works together, that creates competition. Is it good enough that we have one closed-loop system? I love it. You saw the charts. It's working. It's here today, right? But there's 5 others that are in the works and will be on the market within the next 2 years. So what does that do? Well, Medtronic, they can't sit back on their laurels, right? They have to keep innovating. They have to keep improving. They need to get it smaller. They need to get insulin that's working faster. I'm going to give you a really strange slide on that in just a little bit. So this idea of an open protocol where you can use the best CGM along with the best pump and maybe download somebody else's algorithms that are the best and use the best of everything creates competition, creates improvement, and that only improves our lives of us that have T1D or the ones that we love that have T1D. It makes them simple.
Decrease cost.
And it does decreases cost too, and particularly today with insulin and the price of that, that's really important, right? We all feel that. We all feel that. So this is a really exciting thing, and this is, again, brainchild of Aaron, and he's pushing that. All right, so I told you I'd talk about insulin, right? I'm going to move over to this side. I'll be back. So now you got to be, if you're paying attention to these slides, right, you're thinking, why is there a snail up on the screen? And it's not any old snail, it's a saltwater snail. So here's the deal. This snail uses insulin to paralyze its prey so it can eat its prey. Now, I don't know if any of you have studied the speed of snails. They're pretty slow. The insulin in this snail is incredibly fast. It paralyzes them instantaneously so that a slow snail can get the prey and eat it. Now, I have no idea who thought of, hey, let's go see if that snail's secreting insulin. That kind of stuff just blows my mind, and I'm just not smart enough to understand it. But JDRF does, and somebody's figured it out, and now there's another little thread to pull on. Because, you know, those of us in the room without T1D, our insulin acts like this, right? It's strawberry season. Wilmington's got good strawberries, I know that. And so we make strawberry pies, and Chance gets them just like Tasman gets them, right? But you know, when I'm cutting that strawberry pie for my piece, my mouth starts to water, my insulin's already kicking in, and my blood sugar stays flat, right? But the best insulin on the market still takes 30 minutes to an hour to really get up to speed. So we've got to get better insulin. Maybe a snail shows us how to do it, right? But again, this is where some of these investments are going, right? It's really amazing stuff. So those bits of information there, right? That's kind of like my here and now to 5-year horizon. And I kind of term that, hey, that's the high-tech stuff. Chance calls it his gadgets, right? He's got all these gadgets on him. And sometimes he's real shy about it, and he doesn't want anybody seeing it. He goes over here to bolus, and he boluses. And then other times, particularly at JDRF events, he'll whip out that pump upside down and go, and I'm like, whoa, slow down, because Mom and I get really worried about that. So then this is my 5-year horizon, right? What's coming down the road in 5 years, right? Because JDRF is focused on a cure. But it doesn't do any good to put all your eggs in that basket and ignore what's going on for however long it takes to get to the cure, right? So JDRF does a really good job at taking a holistic view of all these things that are out there, right? So those are the high tech. Now I'm going to talk about some biotech stuff. These people are even smarter than the guy that, or the gal that found the snail. So the first thing is beta cell therapies. Viosys is a really exciting company. And I've been following them and getting updates on Viosys for years now. The only reason I knew about them, though, is because when they were in incubation and in startup mode, who funded them? JDRF. Now, they are in human trials, and they have figured out a way to take beta cells and cloak them. Any Star Trek fans in here? You know, the Romulans had those ships, and they would all go, they'd be invisible, right? They started off using like seaweed cells. Again, maybe the same person who found the snail thought of that, but so because diabetes is an autoimmune disease, right? And it's a tough nut to crack because A, you have to get the beta cells back because they produce insulin, but B, you got to stop your body from killing off the cells. You can bring them back, body kills them. Bring them back, body kills, right? So what they did was they cloaked it. The body says, seaweed, I don't know what you're doing in here, but you're okay, right? And they move on, and so they weren't killing them. So now they've got this in human trials. It's working. These beta cells are living in people's bodies, so now they're trying to dial in, do we need 100,000 or 100 million? They're figuring out the doses and the length of time before you replace stuff. But it's really amazing. And I think, in human trials, this is very likely that, and they're seeing success, it's very likely we'll see something within 5 years. Bringing safe drugs and therapy to market is a long process, right? It's a long process. So, cloaking is one thing, right? But you gotta have enough beta cells. So Milton is a scientist up in Harvard. He actually figured out a way to reverse engineer skin cells to stem cells back to beta cells. That's pretty amazing that you can do that. He was actually in a different line of research, and one of his children got type 1 diabetes, and then the second one got it. So he pivoted his entire career, and he's dedicated his life to T1D research, right? So that's one way of doing it, but here's the other thing that's really interesting. When Chance was first diagnosed, the thought process was T1D after 6 months, 3 years, certainly no more than 5, your beta cells were done. There weren't any left. They were all killed off, massacred, whatever, right? There weren't any in your body, so we had to figure out a new way to get new beta cells from somewhere. That's not the case, though. That's not the case. So what they've determined is people that have T1D even decades later still have beta cells. Now they only have 1% maybe of what a normal healthy person would have, but they still have cells. So why does that help us? Well, it's another thread. It's another thread that we can explore with the help of JDRF, right? Because if they're there, then instead of figuring out how to create beta cells, you just have to figure out how to bring them back, right? And there's scenarios where they actually do come back. And they've already figured that out, not enough. And in pregnant women, they can come back in a big way. So this is another opportunity where JDRF is funded that you can lead to possible cures in the future. I'm going to come back to this slide in just a second and talk about this insulin that JDRF is funded. But before that, to kind of make sense of that, I'm going to talk about this. It's more data, more data. So TrialNet. Is anybody in here enrolled in TrialNet or have a child enrolled in TrialNet? So Chance is a twin. So his twin brother Tasman has a 4 or 5 times more likely chance of getting type 1 diabetes. So as soon as Chance was diagnosed in September the next summer, we enrolled Tasman in TrialNet. So once a year, he had to go and give blood, just like a lot of us do on our annual physical, right? But when you're a little kid doing it, you scream and yell, and he hated going, but he always got ice cream afterwards, so it's kind of a balancing act, right? So we've participated in this. And now IBM is also looking at these data sets, and they're bringing their analytical power. Now, from a SAS guy, we have much better analytics. But they're doing good stuff for JDRF, so I'm okay with that. And my mom used to work for IBM, so that's good too. But here's the thing. Why do we care about this? Because there's a couple of things that have happened here. One is, they used to think that people had diabetes when they showed up in the hospital with a blood glucose of 500, 600, 700, 800. And possibly, you know, near death, right? That's not the case. That's not when you get diabetes. Nobody knew that. But in the last 5 years, JDRF, through their leadership, has redefined when you get type 1 diabetes. And it's well before that event. And they know that now because they've determined about 5 markers. And once you get 3 or 4 of those markers, you know that your child, or as an adult, I have 2 friends, one was diagnosed at 38, one at 41, T1D, right? But now they know 5 markers that they can test for, and they know you're going to get it. Now, if you think back about the slide that I just skipped over, right? Why is that important? Well, they've also created drugs. A lot of them are type 2 drugs that they're repurposing. Now they can delay the onset of T1D 2.5 to 5 years. Now, Chance was 20 months old when he was diagnosed. Couldn't tell us if he felt high or low because he couldn't talk, so you can't hold that against him, right? If we could have delayed that until he was 4 or 5, it would have been a huge difference. It would have been a huge burden off our family, particularly off that T1D mom, right? This is amazing stuff. We're very good friends with another family in Raleigh, and their second son, the markers showed up, and they've been in clinical trials, so he's not full-on T1D yet. They know he will be, and that's hard, but they're delaying it. And you know what? Who knows what else comes to market in 3 to 5 years that may even help them more when he's full-on T1D, right? So this idea of data and analytics, JDRF sees the value in that. They're funding that as well. Really interesting stuff. Try not to get too geeky here, right? So, you know, I've talked about high-tech solutions, right? That's not a cure, right? Chance has to do a pump site change every 3 days. He has to do a CGM site change every 6 or 7 days. That's not a cure, but it is a quality of life. Right? We've talked about biotech. That's not a cure either, right? But it could be better. You might have to get a patch once a week or once a month or once a year. And otherwise it's like you don't have diabetes potentially down the road, right? Here's another path, right? JDRF is working on a vaccination. That's not going to help Chance. Vaccination. But he has a twin brother, right? So it could directly help our family. And it could help a lot of other people that don't have diabetes not get diabetes. But here's what's really interesting about the vaccination. This company was making some progress. And you would think, do all this research in the lab, and then you get into a university, and then get into a pharmaceutical maybe, or a startup, and then you do these human clinical trials, and it's got real promise, right? And you're like, hey, that stuff will work, let's get it to market. Home stretch, right? That's where it takes the most money. It takes the most money to get it over the goal line. So what does JDRF do? I love this about JDRF, and this is Aaron. Aaron's fingerprints are all over this. They love thinking out of the box. They're not complacent. They're not happy enough with good enough. They're always thinking, how do we get better as an organization? They've just restructured our whole international board of directors to become more lean and to let people focus more on getting things done, right? They're always trying to improve. I love that about JDRF. So how do you get things that last 5 yards to score the goal, right? It takes a lot of money. You know, that money usually comes from big Wall Street investors, venture capitalists, right? It's people that they're going to place 10 bets, knowing that 8 of these companies are going to fail, one's going to break even, and one is going to go bonkers, and they're going to make enough money to get all this money back tenfold. But sometimes those investors aren't focused on T1D therapies. So what JDRF did was they went out and they started a T1D fund. So this is kind of like donation, kind of like investment, kind of munged together, baked up a little bit, take it out of the oven, see what you got. Here's what you got. You know, we appreciate friends and family. At our walk team, they donate $5, $50 sometimes, right? We throw in a $500 thing. That's all good. That's all good. The folks in this T1D fund, the minimum threshold is $500,000. And they have a lot of people who have already put money in there. So now JDRF has this fund that they will only place good bets on to get things to market. And when it works, some of the money goes back into the fund to replace the money that they spent, and some goes back to the investors. It's capitalism, but it gets things done, right? This is really innovative thinking. I don't know of any other nonprofit that is doing this type of job to help their community. I think it's really amazing, and it's really interesting. All right, so I only have a couple more slides. You guys stick with me, okay? This one I think is really interesting as well. In fact, Aaron is the one that first started talking about this, and I was like, huh, what? So, the Parker Institute out in California, if you can read the small print, it's a cancer institution. Why is that on the T1D research update? Well, an interesting tidbit is an endocrinologist runs the Parker Institute. Guy spent his entire career around T1D, an autoimmune study. He's running the cancer thing. Here's what you may not know. I didn't know it until 2 weeks ago, maybe. Less than a month anyway. Is cancer at a high level. Remember, you can't hold me to any of this because I'm not a scientist or doctor, right? But cancer at a high level is an autoimmune disease that is opposite of diabetes. T1D is an autoimmune disease where our autoimmune system is overzealous and it attacks innocent vein cells that weren't hurting anybody and kills them off, 99% of them anyway, right? And so now we're insulin dependent, right? Cancer is an autoimmune disease where the autoimmune is lazy. They're not doing their job. And these bad cells start multiplying and multiplying and multiplying. And that's how cancer spreads, and that's how cancer kills people. At the Parker Institute, they figured out how to dial some of that autoimmune and swing that pendulum back. All in the name of cancer research. Right? If we can get the autoimmune system for cancer patients to wake up, do the job they're supposed to be doing instead of being lazy, right? We can stop people from getting cancer, maybe. They've been so successful at it that 1% of their patients in human clinical trials now have type 1 diabetes. Now that's not a good thing, right? I'm not suggesting it is. But why is that important? Well, if you figure out the combination to move the pendulum from here all the way to there, now you have another thread you can pull on, and maybe you can pull it back into here and get to an equilibrium. I've talked to a lot of scientists. I've been really fortunate with our involvement with JDRF over the last 10 years to have these conversations, this opportunity. And a lot of these scientists, there's a common thread that they said, you know, we've been working on diabetes a long time. Some of them got into the field in the 80s, and their career counselors, right, in the universities, said, don't go into type 1 diabetes. You will waste your career because they're going to have that problem solved in 10 to 15 years. They'll cure diabetes. This is in the 80s, right? And here we are today, right? We're still raising money, we're still fighting a good fight. But they all say that they think the real breakthrough will come from someone outside of the T1D community. This might be it, might not be, but it's another thread. And look who's supporting Parker Institute, JDRF and Helmsley. This is amazing stuff. This is really hopeful. This is the slide.
That I have originally moved. When you said we're changing technology.
No worries. So, and I'm not going to go through these 11 things. Here's what my grandfather, rest his soul, he couldn't remember guys' names. So he called all the guys Good Buddy. So they nicknamed him Good Buddy, because I'm Cajun, right? And so every Cajun has a nickname. So he was Good Buddy Bernard. And Good Buddy said, the two biggest lies in the world were the checks in the mail, and I'm from the government, I'm here to help you. Now he lived through the Great Depression, so I'm going to give him a pass on that. But here's my thing. Big government is tough to get through, FDA is tough to get through. JDRF has done an amazing job of building relationships deep within FDA and getting them to think out of the box on how you look at a pump. More importantly, pump's medical device, that's easy, right? What if you have an iPhone that's managing a pump? Is your iPhone medical device, right? How do you look at that? They made huge strides in that. There's 11 major things that got approval from the FDA this year. That is unheard of, right? That's really, really strong work by JDRF. So here's the deal. Yes, JDRF is laser focused on a cure. But that cure, maybe it's the Parker Institute with cancer and the autoimmune system, right? That's my 10-year horizon, right? I have an 11-year-old today with type 1 diabetes. And one of the things that I appreciate from JDRF is they're looking at adults with T1D. They're looking at T1Ds that have had diabetes since the 70s and now may have some complications that are really bad things, right? They're working on how we solve for that. They're working on how to prevent other people from getting it. They're working on these gadgets, the high-tech stuff that's here today that really can improve quality and allow parents to sleep. Thank you. And they're working on these biotech stuff. And it's all promising. So, no, I don't think we're going to get a cure by December. Nobody thinks that. But we have amazing stuff that's on the market 3 to 7 years earlier than what it was because of JDRF. We have biotech stuff that's even cooler than that, and you'll be able to get rid of some of your gadgets. That's probably 5 years out from hitting the market. And yeah, there's a horizon line of 10 years or longer. But JDRF will not quit until there's a cure. So I'm really excited that all of you chose to come out and spend some time with us. I really appreciate your involvement with JDRF. I go back to all the different things that Suzanne and I got involved with, from taking photos at the gala, taking portraits of T1D, right? Find one thing and align your passion with something that can help JDRF, and you will be amazed not only at what you can accomplish, but what you will get back in return. We have been, and we are in it for the long run. We're not going anywhere. Even though I've been kicked out of president of my chapter. 2 years is the limit. So, but anyhow, thank you for coming out. I really appreciate your attention, and be